It's my pleasure to introduce Seema Verma, who's been actually part of the policy circle since its early beginnings. Seema served as the administrator for the Centers for Medicare and Medicaid Services from 2017 to 2021, and she's now on the board of numerous healthcare companies, namely WellSky, Lifespan, Monogram Health, Numeris, and she's on the advisory board of Tapestry Health. Most recently, Seema was instrumental in drafting a legislation for transparency in pricing, which took effect last July. And this legislation requires most group health plans and issuers of a group or individual health insurance to post pricing information for covered items and services. Now, what this transparency regulations do is lay the foundation for a market-based healthcare system and represent the dawn of enlightenment for patients, the physicians who help them coordinate their care, and for policymakers. So, Seema, you were also instrumental in allowing CMS to reimburse healthcare providers for remote consultations, which unleashed telehealth. So, you've reached a place where you can influence healthcare public policy, and in turn, that fosters innovation to provide us with the best care. So, in this interview, I want to connect the dot backwards to share with our audience your journey in public policy making. So, my first question to you is, what was your very first pivotal career decision that you felt really launched your journey?
Sure. Well, I call that story Two Mitches and a Mike. And it started probably about 25 years ago when I moved to Indianapolis and I was interviewing for jobs. And I had two choices. And one was a job inside the Medicaid agency, learning about Medicaid policy. And the other job was a little bit more ambiguous, but it was with a gentleman, Mitch Robe, and he was running the Marion County Health and Hospital System. So it was the public health department and the hospital. And the role was around maternal and child health, which I wasn't necessarily super interested in. But Mitch was a very exciting leader and talked about how he mentored his employees, and he was very much into politics. And so not just policy, but also politics. And so I kind of hedged my bet where, going to the Medicaid agency probably would have been a safer bet, and I would have learned a lot there as well. But I made this decision to go work for somebody. So I made the decision based on the leadership. Mitch Robe then introduced me to Mitch Daniels, who then became the governor of the state. And I went on to work with him on his healthcare plan. And then, years later, he introduced me to the guy that was going to replace him, which was Mike Pence. And then Mike Pence introduced me to President Trump. And that's sort of my journey to CMS. So it really started with that first decision of going to work for somebody that I thought, was a leader, and that was also interested in mentoring young people as well. So that's how I call my story. Two Mitches and a
Yeah.
Mike.
Two Mitches and a Mike. Yeah, well, it's interesting also to pick someone who you feel will be a mentor that's also very connected, who can see the bigger picture
Right.
of how you can become influential. So what types of goals, like did you have some goals that you set out to achieve, or did you have a vision of your career or always wanted to impact healthcare access, affordability, the public health system? Did you start off with those goals?
I wish I could tell you that I had that big vision, but I think I was very much focused on what was in front of me and trying to do the very best with whatever topic I was faced with. So early on, it was HIV/AIDS, maternal and child health. Then I started working on issues of the uninsured. And as I looked at each of the issues, it was, how do we fix this? How do we resolve it? And so not just thinking, big picture here, what are the influencing factors. So it's not just what's going on in the local health department, but what's going on at the state level, what's going on at the federal level. So I think in healthcare, it's one of those areas where it's not just what's going on in the doctor's office. There's so many things that influence it, the patient's life, but also a lot of different policy. And so I looked at this as, when I looked at any project or anything that I was working on, was how do I make it better? And that always involved going outside, right? It meant going to the state, going to the federal level.
Yeah, and also you it sounds like you also paid attention to who are the influencers and the decision makers, and you were part of those political circles, and you kept nurturing that ecosystem of relationships of people who could actually implement the policies that you felt were the best one to transform the healthcare industry. How do you share a little bit how you continue to nurture your ecosystem of relationships and to advance your goals and your leadership? Are you very intentional about it? How do you maintain that?
Well, I will tell you that I haven't been as intentional about it in the past, but I recognize the importance of it. And I think probably over my career, I've become more intentional about it. Early in my career, like many women, I'm juggling a family and responsibilities at home and also at work. And so, a lot of times it was all I could do to, drop my kids off at school, go to work, and then, I'm eating lunch at my desk because I'm trying to get my work done. And so the relationships that I developed, I think, were really around the work product. I got to know Mike Pence or Mitch Daniels, not because we were buddies hanging out on the golf course. It was because we were working on something together, and hopefully I was producing good work for them and good results for them that was helping them achieve their goals. And so that's where a lot of the relationships developed around the work that I was doing. Over time, you're able to develop relationships and get to know people and be a little bit more social. But I would say early on in my career, I didn't always have the time to do that. And so I focused on just doing the best job that I could do. And, by doing that, you get to know people, and people are interested in your work. They want to talk to you. They want to share ideas. And so that ecosystem of relationships was really centered on the work that I was producing.
Yeah, thank you for sharing that. So, how did you raise you had a relationship with Mike Pence, and then how did you raise your hand to be nominated to become the administrator of CMS? And maybe you could share a little bit what CMS is. I mean, it's serving 150 million people, right, who subscribe to Medicare, Medicaid, the health insurance marketplace, the CHIP program. Did you actually how did you raise your hand
Yeah. Well,
to say, yeah, I want that job?
right. Well, CMS is the largest insurance company in the world. And what goes on there influences, as you said, 150 million people that are on the programs. But CMS also sets the quality and safety standards for every healthcare institution in the country. So their influence is really beyond just Medicaid and Medicare and the health exchanges. It's really the entire healthcare system. And so, I really wanted to make a difference and have an impact. And if you look across the federal agency, my background is all in healthcare policy. And so when you look at all of the different agencies and where you could potentially work, I kind of looked at CMS as that's the most ideal place. I had been working on the campaign with President Trump and Vice President Mike Pence. And so, when it came time after we won the election, they were trying to figure out where to place people and if you wanted to go work for them. And for me, I thought it was an incredible opportunity to make an impact. All the things that I had been studying over the last 25 years, whether it was problems in primary care, problems in reimbursement or price transparency. It's like, okay, you know what? It's an opportunity to really have impact and do all the things that we've been talking about for so many years.
Yeah, well, thanks. Yeah, definitely a huge impact. And so, what would be your advice for leaders to encourage them to go into public service? It's a big jump, and it's big uh, responsibility. And what would be your advice?
Well, when I think about public service, just for me personally, I'm a daughter of immigrants. And so it's not lost on me the incredible opportunities that this country provides people. And I know not everybody sees it that way, but my experience has been very significant. And I contrast my life with some of my cousins in other countries. And I feel like I've been able to do more and have more opportunities. So for me, public service is an opportunity to give back in some ways. And it wasn't easy. My family was in Indiana, the job was in DC, so I commuted every week. You work these 12, 13-hour days, and it's unrelentless. There's always something going on. But, what I got out of it was I learned an incredible amount. I mean, a lot of times if you're working at a job, you're sort of only focused on one thing. In government, you get to see and impact the entire ecosystem. And the things that we were able to do, it's not just impacting a small number of people, it impacted the entire country. I'm super proud of the fact that we will have price transparency in healthcare in this country. We didn't have that 5 or 6 years ago, and it'll take some time to get ingrained, but it'll change the way we look at healthcare. It'll change the way people make decisions. There was some work that we did around giving people access to their electronic medical records. And so if you go to your doctor's office and they give you a portal and you can see your test results, that is directly from the actions that we took at CMS. So with public service, you have an opportunity to make an impact on a big number of people. And hopefully, an opportunity to change your environment, to change your country and your community and make a difference. The other thing I would say about public service is that you really get an opportunity to do more than you may in a smaller company or in a larger company. In government, you may be asked to do something that you don't necessarily have the experience to do, but you'll get those types of opportunities in government. I think some of those things you don't always see in the private sector. So I think it's a great way for people to, learn more about management and leadership as well as policy. And so I hope that every person at some point in their lives will give a couple of years back to the government in their
Yeah.
careers.
Well, that's really inspiring. Thanks for sharing. So in closure, tell us, what is your mantra? What do you tell yourself when things are going a little bit, when the road is rough, the batteries are low? What do you keep telling yourself?
You know what? I'm kind of a never give up. Shoot for the moon, aim for the stars. That's what I always tell my kids. Because even if you fall short, you'll still land among the stars. So, you just always have to have a very, very high standard and a high bar and be unrelentless in your pursuit of your goals and your dreams. You just don't give up. We all have setbacks and things that aren't going well. And I think sometimes you just have to be patient and focus on the things that you can control. For me, it was sometimes I can't control this, that, or all these other external factors. I can control what I do, the work that I do, the quality of the work that I do, the relationships that I have. And so, focusing on what you can control and working as hard as you can.
Yeah. Well, thank you, Seema, for this short interview. It's really inspiring and real pleasure to talk to you today.
Yeah.
So
Thank
thanks.
you so much.
Thanks.